Nepal and India studying food and land issues. Currently, he is working out of the Des Moines office of the American Friends Service Committee, where he is Hunger and Human Needs Program Director for the North Central region. He has been studying hunger and land issues in Iowa, and that's what he's going to talk about tonight. Hidden Hunger in Iowa, Pride and Social Policy. This is Mark Chelman.
Thank you. If we could have the lights down, please. That's really strange. I was hoping that this room would have a rheostat so we could adjust the lights. We'll have to see how this slide presentation works. I just have a few slides, and perhaps it would be better if I just ran through those at another time, perhaps later on in the presentation. Why don't you turn the lights back on? I really have a hard time talking to a completely dark room. It's very strange. But at any rate, it is my melancholy privilege to speak to you tonight about hunger in Iowa. Although Iowa has a relatively small percentage of low-income people, those people, their poverty is often overshadowed in the imagery of white farmsteads governing 400 acres of land, which are powered by shining red and green four-wheel drive tractors. The fact that there is hunger in Iowa should serve as a growing sense of embarrassment to a state famed to be a breadbasket of the world. The cornucopia of Iowa's bounty simply has not reached the low-income people through no fault of their own, lack sufficient means to maintain adequate diets. Tonight, I'm first of all going to discuss more about this poverty and consequent hunger in Iowa. Secondly, we'll trace the history of the development of social political attitudes and policies that we now direct towards low-income people. And then thirdly, I want to speak about the causes and the actual costs of underutilizing food aid assistance programs here in Iowa. Then finally, I'll offer a few alternatives, and then we'll open it up for discussion. In 1973, 74 of Iowa's 99 counties were declared failure to feed states, or failure to feed counties, in that these counties failed to reach 33% of the eligible population with food stamps. As late as 1976, only 23% of Iowa's eligible population was participating in food aid assistance programs. The fact that poverty is less severe and less graphic than other nations or other areas of the nation, and hence not gaining national attention, has been a factor in the underutilization of food aid assistance programs in Iowa. The same 1973 survey, which declared Iowa as a failure to feed state, found that southern states with higher incidences of poverty were actually doing a much better job in administrating food aid assistance programs. For example, in Alabama, only one of their 67 counties was declared failure to feed in 1973. Louisiana had 2, followed by Mississippi with 3, and South Carolina with 5 failure-to-feed counties. The Midwest in particular has an extremely poor track record in administrating food aid assistance programs. Kansas has 99 counties. In 1973, each one was declared failure to feed. 73 of Nebraska's counties were declared failure to feed, and again, 74 of Iowa's 99 counties. It is to this end that Iowa's welfare system could more appropriately be termed bad fare. For welfare refers to a condition of a state of well-being, of good fortune, of happiness. But in reality, to be eligible for welfare assistance in Iowa means a continuing struggle just to maintain adequate nutritional intake. In 1979, more than 225,000 rural Iowans were declared poor. Using HEW guidelines, this means that these individuals were living on less than $109 per week. In 1979, Carol Tucker Foreman reported that over the last 4 years, average earnings for American households rose 40%, while the earnings in that same period for low-income households rose only 7%. Low-income households were found to be spending around 90% of their earnings on housing, food, and medical care. Tom Minskaman, a community action director from Cedar Rapids, related that low-income households have learned to stretch their food dollar until it screams. He went on to say, "It's sad, but we run across people who haven't even heard of the food stamp program." Now, just this morning, I spoke with Carol Jones, who's the Community Food and Nutrition Coordinator for a CAP agency in southern Iowa, where in that southern tier of counties where there's the most poverty in Iowa. And she was relating the fact that that programs there are very underutilized, disproportionately more so than the rest of the state. And it seems to be a pattern that areas of higher incidence of poverty within the state of Iowa have even a poorer track record in dealing with that poverty. But before further discussing Iowa's poverty, it is important to trace the development of the socio-political attitudes and policies directed towards the poor. For these attitudes, we have our historical roots and century-old traditions of lacking in real concern. And even today, there's an uncanny resemblance between Elizabethan poor laws, which established bread lines in poorhouses, and today's welfare system of food stamps and county poor farms. So both systems are aimed unduly at just maintaining the poor, at maintaining the poverty, at just establish it to continue on, but with no real direct efforts in changing the existing order. It was in the Elizabethan tradition that America's system for assisting the poor was well established by 1700. It was a system of workhouses, poorhouses, prisons, charity hospitals, and public dole. But the Panic of 1837 brought a welfare boom to the United States, and bread and soup lines became a common scene. But it was in the 1830s then that we see a rise of the laissez-faire and the political philosophies, and also a rising of social Darwinism, which stressed the survival of the fittest, and it was a system then that was used to justify wealth and poverty. It's important to note that the laissez-faire political philosophies and the social Darwinism attitudes were entrenched at that time, and today they've developed into an ideology of blaming the victims. That is, victims of poverty are poor because they are somehow thought to be unfit, mentally defective, lazy, shiftless people who at best deserve nothing more than handouts. The lunacy of this ideology reached its height in the Great Depression of the 30s, when the stigma against certain groups of unemployed was so great that these unemployed internalized their plight to the degree that they would actually go through the measures of leaving for work every morning just to make sure that the rest of the public or the community didn't find out that they had lost their jobs. And yet, even today, the welfare stigma has played an all too unkindly role in the underutilization of food aid assistance programs. It was then during the Depression when thousands were going hungry at the same time that farmers were dumping their milk and destroying their produce rather than accept low prices, that one of the major welfare systems was established, and that was the commodities program, which was the forerunner of today's food stamp program. In this system, government bought up surplus from the farmers and distributed it to people in need. But with the advent of World War II and the ending of the Depression came a dismantling of the large-scale anti-poverty programs that were established during the Depression era. Then the issue of hunger didn't surface again in America till June of 1967, when the Field Foundation's team of medical doctors investigated hunger and malnutrition in southern states. Their conclusion shocked the nation as the following testimony was given to Congress. Wherever we went and wherever we looked, the doctors reported, we saw significant numbers who were hungry and sick, children for whom hunger and sickness was a daily fact of life. The children we saw were more than just hungry. They were malnourished, weak, and apathetic. Their lives were being shortened. They were visibly and predictably losing their health, their energy, and their spirit. And the report, the testimony to Congress goes on and on with those types of statements. Then following the Field Foundation's report came a number of studies which looked at poverty in America, especially in areas where poverty was more severe. And probably one of the best known was a CBS documentary which graphically displayed malnourished faces on millions of TV screens across the nation. Why don't we show a few slides now at this point, and we'll see how this goes. It's because of Iowa's imagery, again, of farmsteads and large equipment, and that poverty is often overshadowed. And again, it's the idea of hunger in a midst of plenty is just an incredible idea, that we have silos all along the river and throughout even the central part of the state like these, full of grain, and yet hunger exists in Iowa. It's this type of poverty that is there. Oops. Now this is the 1973 census, which found so many of Iowa's counties to be failure to feed. It's one of the classical studies. These headlines were generated out of reports that the American Friends Service Committee wrote along with the Advocated Welfare Answering Service in Waterloo. And in the recent 70s, we've seen some interest by the press in hunger issues. Now, the darker areas are where the most severe forms of poverty are in Iowa. Iowa has a system of 19 community action programs, which govern about 5 counties, and they often administrate various food aid assistance programs. And they've produced these maps. The community action agencies are a spin-off of the old Office of Economic Opportunity. Now there's one thing that seems to be characteristic of the poor, and I happened to find it in this family, and that is that illness seems to be prevalent. Those 19 community action agencies did a survey, and they found that in most of the families living in poverty that there was some form of pretty severe illness. And this gentleman to your left has diabetes, and his wife has given birth to 2 children. One was an epileptic who then gave birth to 2 children who were retarded, and that's just another one of their grandchildren. Okay, let's turn the lights back on. Okay, so in the decade that followed the 1967 so-called discovery of hunger in America came a massive mobilization of food aid assistance programs and the food stamp program has been one of those, which has grown from a small program which served 2.8 million people in 1968 to a program which now serves around 22 million people. Other major federal food aid assistance programs include free and reduced price lunches and breakfasts at the schools across the state. Perhaps one of the most important federal food aid assistance programs in terms of warding off hunger and impaired physical and mental development of low-income children is the WIC program. The WIC, it's known as the Supplemental Feeding for Women and Infants and Children program. The WIC program attempts to identify low-income mothers who are either pregnant or breastfeeding, and through a simple health survey they can tell if they're of nutritional risk to the degree that the development of the fetus or the nursing infant may be impaired. At that point, the WIC program comes in and offers free prescriptions for nutritional food to bring the health of the mother up, as well as the children who may be under her. And then the program goes on to provide free education, free health education. Now, it's interesting to note that the WIC program is underutilized more severely than the food stamp program, in spite of the fact that the WIC program may be more important in terms of guarding the health and the development of children. Sharon Robertson is the state director for the WIC program, and we've talked with her recently, and she said in the last 3 months they've identified 1,000 new families in Iowa who come under the guidelines of the WIC program. But she's saying because of the federal cutbacks in social spending that it's very possible that they won't have enough funding to continue on with the program for these newly identified women. Okay, but at any rate, following the so-called discovery of hunger in America again, we saw a massive mobilization of food aid assistance programs. But it's unfortunate that they've been targeted at the most graphic forms of malnutrition and hunger in the United States, and they've succeeded in dealing with that quite well. Now that's fortunate, but it's unfortunate that those types of programs haven't reached places like areas like Iowa and still remain underutilized today. But it's in states like Iowa that social political attitudes directed towards the poor people have left a legacy of underutilized food aid assistance programs, which have hurt both Iowa's economy and the welfare of low-income people. In 1975, the American Friends Service Committee, along with other food advocacy agencies, filed federal suit against the U.S. Department of Iowa, or the U.S. Department of Agriculture, and Iowa's Department of Social Services, and that they were failing to carry out meaningful food stamp outreach programs, and that they just were failing to allow low-income people to learn of the availability of those programs in a meaningful way. This is in spite of the fact of federal regulations that mandating that they do so. Now it's important to note that the cost of the food stamp program is borne by the federal government. Iowa only has to pay 50% of the outreach and administrating. So when Iowa chooses to turn down these federal funds, it comes at an economic cost to the state, and I'll talk about that a little bit later on. But currently, Iowa has 99 nine food stamp outreach workers in each county, but they're only spending about 10% of their time on outreach activities, with a few district coordinators spending about 5% of their time on outreach. It's the position of the American Friends Service Committee that the state should have at least 19 full-time workers. This is due to the fact that currently, as of last year, 44 Iowa counties were still declared failure to feed, and they're only reaching 45% of the eligible population. Now, Dr. Wheeler is one of the nation's most predominant spokesperson on domestic hunger issues. On April 30th, 1979, he gave the following congressional testimony, and I'll just sort of summarize it. My colleagues and I are often observe the more subtle forms of malnutrition, particularly among the poor, where food aid programs are underutilized or not reaching those who need help. He went on to say that undernourished children become slow learners, wind up living in poverty, and go on to produce children who grow up in a vicious cycle which condemns them to a lifetime of marginal function. Their lives are characterized by behavior disturbances, physical disabilities, high rates of failure in school, and low rates of employment. And then he goes on to say that the social and economic consequences of this tragic sequence of events are enormous and devastating to the children and to the society for which they grow up. A few days ago, I talked with Dick Wagner from Northeast Community Action Agency, and he supported this type of a statement, and he went on to say that he had recently viewed a film that was done by the WIC program, which documented the very same types of things that children who are undernourished aren't learning as well as in school, will have more discipline problems, and it just starts a cycle of poverty. And more than 10 years ago, the Office of Budget calculated that for every $1 we fail to spend for food aid assistance programs now, we end up paying $3 more in terms of payment for sickness care, low productivity, and so-called handouts to the disabled. You know, it is with this reasoning then that advertising slogans like "buy now or pay more later" certainly are appropriate when it comes to food aid assistance programs. The Iowa School Breakfast Program study was another classical study which looked at the effects of the omission of breakfast on learning abilities of children. And in that study, they found that children who are not eating breakfast often are slow in psychological performance towards the end of the morning, as well as having more discipline problems. Okay. Now, on the other side of the coin of the cost to the low income or the poor in Iowa of the underutilization of food aid assistance programs is the cost that comes to the state of Iowa and to Iowa's economy by not using federal dollars. The USDA has a recent report saying that for every $1 in food aid assistance that goes to Iowa, 42% of that goes, or 42 cents of that goes directly to farmers, while the other 58 cents goes to retailers and producers. And it's because of this, in 1976, for example, Iowa farmers received between $79 and $104 million because low-income people were able to buy more food with food stamp dollars. But the report goes on to say that, however, because Iowa farmers are losing out on millions of dollars in sales annually due to low food stamp participation rates. Or put another way, the state's refusal to spend funds for food aid programs
designed to increase food stamp participation rates is costing farmers millions of dollars annually. And additionally, for every $1 spent in food aid assistance, that dollar goes on to generate $3.40 worth of new business in our economy through the multiplier effect. Now, another side of the welfare issue is that the types of welfare that we're delivering. And again, it's been, still by and large a type of welfare that maintains poverty rather than to do anything to change it. And it's still, very much similar to the Elizabethan breadlines. Our welfare system may have become bureaucratized, but other than Depression-era work camps, wars, little has been done to provide employment or jobs. In its original form, the Humphrey-Hawkins bill would have provided jobs to the poor. And really, herein lies the crux to the welfare issue. That is that a large share of welfare recipients have become dependent upon government assistance programs, not because they are lazy or shiftless, but because the economics of capitalism has become increasingly unable to provide jobs for all. And so when welfare payments go to able-bodied people and their dependents, it serves to apologize for defects in our political economy. The original Humphrey-Hawkins bill could have corrected these defects. It was opposed on grounds that it was unaffordable. And it really sort of escapes my reason to realize why it's been deemed cheaper to pay people for not working rather than to provide employment. It seems to me that a modern anti-poverty program should have two major thrusts. One is to provide assistance to the disabled and their dependents, and secondly, to provide employment to the able-bodied, as well as continuing on with some assistance until the transition from unemployment to employment. But what's happening in our economy today, that with the advent of high taxes and high inflation, which is threatening the standard of living for the middle class has come to vent its frustration on the poor through a type of proposition mentality. But it's the position of Representative Hawkins from California that tax reforms have come to mean a reduction of taxes for the middle income by cutting social programs for the poor, rather than closing the loopholes for the wealthy and shifting the tax burden to those who are in a better position to pay. Representative Hawkins also feels that the Carter 80-81 budget is designed to restrict the economy and create a recession by increasing interest rates, which increases unemployment, as well as slashing domestic spending. Recently, the Children's Foundation, based in Washington, D.C., reported that Congress is considering a $1.4 billion cutback in the food stamp program. In the interest of balancing the budget, the Carter administration is threatening the effectiveness of the food stamp program more so than any other administration since the program's creation 18 years ago. The Children's Foundation report goes on to say that the proposed cutbacks in the food stamp program will mean widespread hunger and malnutrition for more than 20 million of our nation's poorest citizens. Now, in Iowa, there are currently 141,000 families participating in the food stamp program. That number has increased 9,000 people since January. So we're seeing, because of the economy and because of unemployment and spiraling food costs, that there's been people are becoming more dependent upon the food stamp program at a very time when Congress is threatening to cut it. In fact, it appears now quite likely that in the month of June that no food stamps will be issued across the entire nation unless Congress acts within the next 7 days to appropriate more money to carry the program out to the end of the fiscal year. Now, the reason the program's run out of money is because when they appropriated the money, they failed to anticipate the high unemployment and the high inflation rates that are bringing more people to the food stamp program. We know that for every 1% rise in unemployment, that generates 750,000 people across the nation who then turn to food stamps for So it seems that what's going on in the interest of balancing the budget and dealing with inflation, that all of those measures are being disproportionately borne by the poor and the low income, and they're the ones that are really suffering because of the recession, because not only are they being laid off, but then they're being denied assistance programs once they're unemployed. Now, in conclusion, before we have some discussion, I would just like to say that as an Iowa farmer, it's hard for me to talk about the food issue without discussing the land issue, at least here in Iowa. There's been a recent USDA report out saying that by 2020, 40% of southern Iowa cropland will have reached third-degree soil erosion, which means that that instead of the black soils that are traditional for Iowa, we'll be seeing hillsides covered with red and gray clays. Once the soil reaches that state, you have to, it takes more energy to farm it. You have to gear down a gear, and it takes more fertilizer, it takes more inputs, and yet you have less outputs. At the same time that's occurring, every 10 years, the equivalent of 2 Iowa counties go from agriculture production into non-agricultural uses. Oh, I know. Why don't we go ahead and I'll show you the rest of the slides. This report looked at the Field Foundation's findings 10 years after. In 1977, the Field Foundation went back to the same areas where they had seen so much poverty before and looked again and didn't find the types of malnutrition that existed before.
They did not find?
They did not find the types of malnutrition that existed before 10 years earlier. The chronic cases, the more graphic cases of malnutrition was covered over or was dealt with. This is a slide of the school breakfast program in one of the local schools. And it's because the program is able to buy up agriculture produce and distribute it to people in need that benefits both low-income people and Iowa's economy.